Good evening. My name is Sebastian Martin. It's an honor and a privilege to be here. So grateful for this opportunity. I am the executive director of New Life Houses. I've been working in the mental health and substance use prevention field for over a decade. As a young man, as a teenager, I struggled with my own substance use, been clean and sober for a decade and a half, and it's just a privilege. I've been on the Substance Youth Coalition in the Beach Cities area, spent a lot of time talking at all the local middle schools and high schools. And so we're really excited to engage in this conversation tonight to talk about hidden highs and the new age of substance use. I want to introduce some of the other people that will be joining me in this panel discussion. Karissa, do you want to introduce yourself?
Sure, thank you. So my name's Karissa Provost. I'm a licensed marriage family therapist and clinical director of Clear Behavioral Health. Sorry, I just got a message. Okay. Outpatient programs for adolescents and adults. I've been working in the field for over 20 something years. of aging myself there. And have worked with a lot of adolescents struggling with substance abuse. So thank you for joining us.
And we're also going to be joined by Dr. Tim Harmon this evening. Tim, would you introduce yourself?
Absolutely. Yeah, thank you. And good evening, everybody. Thank you so much for being here. Again, Dr. Timothy Harmon. I'm currently the program director at Clear Behavioral Health. I serve over there our outpatient primary mental health location for adolescents and adults. We've been working in mental health and substance use. It's for about a decade now, also as well. So I'm highly passionate about this topic and also this, specifically the ways that it impacts our adolescent demographic. So looking forward to being here.
And listen, we want this to be as informal as possible. Our goal is to leave parents or anyone that may be joining this conversation with some tangible tools that they can go home and bring into their homes and start applying immediately. Obviously, we're here to provide some education and just appreciate it. In my experience, talking with parents and talking with students and young people alike, just you as folks that are concerned, community members here being in the room and engaging in this is a really great way to obviously get education. And so please, we're going to do our absolute best. We have a lot of questions that we hope to cover in a short amount of time. We're going to do our absolute best. At the end of this conversation, there will be some contact forms. If you have specific questions and you'd like to get a hold of myself, Tim, Karissa, that we're here and we're available. This is a passion of ours. And so by all means, we would love to be spending our time connecting with folks in our community and really making sure that you're as prepped up with as many of the facts as possible. So please, we're going to do our absolute best to answer all of the questions that are circulating around the chat and all of the questions that were submitted prior to this webinar. I'm going to announce this. The webinar is intended for general education purposes only, does not constitute medical advice, diagnosis, or treatment. If you have concerns about your teen's mental health, please contact a licensed healthcare professional directly. Obviously, we'll make our contacts available after this, but again, we're going to hop right into the questions to be as concise as possible to make sure that we can do our best to answer all the questions that have been submitted. So one of the first questions that we got is, what are some good conversation starters with preteens and teens for parents and guardians to have an open and honest dialogue with them? Karissa, do you want to take that one?
Sure, I'll take it. So great question. Actually, in some families, the conversations might start even before preteen, particularly if there's a family member who is actively abusing substances and it's impacting the family. But I will focus specifically on the question for preteen and teens. The conversation should really be age and developmentally appropriate. And you want to get a sense of what your preteen or teen knows. What information do they have? What do they think about substances? How do they feel about them? And so the talks began with open dialogue that does not include language that is shameful or judgmental or fear-based. And so approaching your preteen or teen in this way, you're more likely to have a more honest and open conversation and dialogue. So some examples, again, you want to titrate the conversation based on what they already know and developmentally and their age. But maybe some questions might be, what do you think about smoking and vaping and drugs? Just kind of getting that conversation started and hearing what they're exposed to in social media and conversations at school, TV shows, movies, and what their thoughts are about substances, what they're feeling about it. Questions like, um, how would you know if a medication was safe for you to take that was given to you by somebody? And then they become more sophisticated as they get older. Things like, do you think it's safe to stick with marijuana and use that substance? What would you do if an acquaintance offered you a pill to help you with your stress levels at school? And they become more detailed as you are having these open conversations. So really just being open and honest, and coming from a place where they feel like they can ask questions.
Awesome. Another question that we got, which may be specific to the South Bay, because we know that e-bikes are very prominent in the South Bay and just boundaries with transportation. So one of the questions I'll direct to Tim, how can I set boundaries around transportation, social outings, or technology in ways that feel reasonable to teenagers?
Absolutely. Yeah, and such a good question. I would probably start with, I think, stating the fact and knowing that, when we're setting boundaries, there's a question of imminent safety, right? And if I'm at the point where I'm not just like in a dialogue with someone, I'm at the place where I need to set a boundary, it is because of safety, and that might not ever feel reasonable. And there's a difference between it feeling reasonable and it actually being reasonable. And because of that, I would probably drift more to the way in which and the how I set that boundary, right? One of the things that we talk about often here in programming is really communicating the feeling behind the boundary and less the data, the story, the lecture, right? That really sends teens running so often, and more often than not, right? So the difference between, it makes me feel scared that, your choices could impact your future is so. And because of that, I have to take this stance of like X, Y, and Z, no bike. We have to remove this variable, right? Is so different than you're going to ruin your life because you're making these bad choices. And X amount of teens, struggle with X, Y, and Z because of this. And prognosis is this, right? It's about that very, connection and relational or, emotional connection that creates that space to be successful in setting that boundary, which is
So,
probably a theme that we'll go on and talk more about throughout this presentation, certainly.
totally. Another question that we got are, what are the signs and symptoms of various types of drug use? And there's a lot of nuance here, and I'm going to do my best to answer and synthesize this question. Listen, I always encourage parents, and while this may be a little ambiguous, trust your gut, right? And it's so hard to disseminate between what is typical teenage angst and what may be a sign of something a little bit more sinister really transpiring and taking place. I always encourage parents to trust your gut. And some of the things that I always encourage them to kind of consider is if there is a rapid change in like passions, friend group, things like that, those are certainly signs and symptoms to investigate. But what are signs and symptoms of different types of substances? In my experience, cannabis is one of the most common substances that's being used for teenagers just because of the accessibility to that, as well as vaping, nicotine, things of that kind of nature. So you're going to look for mood swings. You're going to look for acts of aggression when it comes to things like vaping. With cannabis use, you're going to look for engagement kind of falling off from previous passions, hobbies, things of that kind of nature, tiredness. Yes, you can look for the red eyes, but I'm telling you right now, these young folks are very, very smart and they are very crafty with the ways in which they are going to attempt to hide these types of substances. So if you see things like Visine being stored around your young person's room, in their car, anything along those lines, that should be a sign and symptom for you. And really, like, what are the preventative measures? It's so hard to say. I think parents really just want to get to know their kids and get to know their kids' friends. That would be a really, really good indicator. When they're coming home from a social event, I always encourage parents, hey, lay eyes on them. If you have the opportunity to, if they're coming home at a reasonable time, you will be able to tell. I always tell parents, like, hey, you got to trust your gut. You may not be on the bullseye, but the likelihood is that you're going to be on the board somewhere. Other indicators, change of grades, where they start struggling in school, attendance at school, lack of engagement in passions and hobbies, things like that. We can go on, but I always encourage parents to trust, but certainly verify, right? And so confirm, confirm, and confirm, and make sure you're just laying eyes on them. You usually can tell that something's going on there. Another great question that we got is, what is developmentally normal level of experimentation for teens? Karissa.
Yeah. So teen experimentation, that's sort of a rite of passage, right? We've all were teens once and experimented in some way with some sort of, engaging in risky behaviors. Developmentally, that's appropriate because teens are starting to individuate and take some risks and chances. With that said, I think the most recent research polls were over like 50% of teenagers in their senior year have tried drugs, and it's even higher for alcohol. So even though it's a norm and sort of an accepted experience, particularly in our culture, doesn't make it safe, especially in this day and age. The substances are not what they used to be. And it could have really serious consequences, just what we might normalize as teen experimentation. Um, so we were talking, before we started the webinar, just about some pretty, we've all heard some really serious events that have occurred, consequences of what was considered or deemed, typical teen experimentation. I think I read something somewhere that, the teens that typically, die from a substance abuse related issue are usually not addicts. They've been experimenting. So it's really serious, even though it's a norm.
And just to chime in on this one too, right? I come from when it comes to parenting, working in substance use, I've seen a lot of the underbelly of young people just experimenting, right? And so I think the days and age of experimentation, in my hope, would slowly come to an end, right? Because the stuff that's available through means like online purchasing, right? These young people don't have to go to some seedy part of town anymore to get access to substances. This stuff is available through Snapchat, Instagram, Telegram, other social media avenues. And it's really, having done talks like this with Chief LeBaron of the Hermosa Beach Police Department, he's reported that half the stuff in 2021 taken off the street in Hermosa Beach would had trace amounts of fentanyl in it, right? And so while it is that I'm so glad to see fentanyl deaths and overdoses on the decline, I think we have a responsibility to really educate it. And it starts with vulnerable conversations and making sure that our loved ones and our teens are aware of the risk. And especially in communities like the South Bay, I've also seen that cannabis use is really a little bit more accepted, right? And I just want to preface and educate anybody that may be on this call that cannabis use today in 2025 is vastly different than maybe the joint you smoked at a concert 20 some odd years ago. It's a significantly higher concentrate. It's not regulated by the Food and Drug Administration. If we were to go purchase alcohol in a Walgreens or Trader Joe's, we're going to know the alcohol by volume, what would be in that bottle, whereas the cannabis industry is not regulated in any respect. And so young people who have greater access to this stuff are really encountering significant mental health crises. And so we have a responsibility to really try and curb this experimentation as best as possible, because it seems to continue to be trending in that direction, that kids are curious and they want to explore. But unfortunately, Tim, Chris, and I have seen the underbelly of that side of thing and the consequences that easily come as a result of that. Tim, do you have anything you want to add to that, or?
Yeah, I mean, I think you both touched on it so beautifully, but plan for the worst, hope for the best. If I was to summarize in that sense, like again, everything that Sebastian's mentioned, the chemical compound and makeup of what we're dealing with is not the same, and because of that, I think warrants a potentially a more direct approach. but yeah, you know, and I think some of the other layers of this we'll get to as we continue talking. But yeah.
Awesome. Another question.
Sebastian, I'm sorry, I didn't mean to cut you off. Can I just add one more piece? So
Sure.
there was another part to this question. I think it was the same person. It's a great question. Referring to an old campaign, again, aging myself here, to This Is Your Brain on Drugs, for those of you who remember that, and the egg frying in the frying pan, and how maybe that worked for some folks at the time. So I just wanted to share a little bit about just my own experience of that campaign. Initially, it scared the crap out of me. But then I started noticing my friends in high school that were, trying substances and having a great time, and their brain was not a fried egg, right? Um, so the campaign is sort of changing. And although, again, it might have worked for some people initially, over time, research found that it wasn't that effective.
Yeah, the scare tactics.
The scare tactics.
The scare tactics are, yeah, we've seen time and time again that they're not that effective. Because if young people are being told, like, hey, you smoke weed once and you're going to end up homeless, right? And they don't end up homeless, they have a hard time seeing that and connecting with that on a community level. And that's, yeah, part of the challenges. Another question that we got is what are effective ways to foster open communication and trust so teens will share struggles without fear of punishment? Karissa, you want to navigate that one?
Sure.
Or Tim, whoever,
Tim, I
or
think
Tim.
Tim.
I think Tim, yeah, by all means.
Sure. Such a good question. And this is gonna be one that's hard for me to not go far in this. I think this could probably be found on a bumper sticker somewhere, but it holds so much truth, especially with adolescents, and that, you know, effective communication is more about how well we listen than what we say. And I think that's has such implication on when we're working with teens, and especially in, you know, trudging through some of these really challenging topics and scary topics. And there's this idea of like a emotional attunement or misattunement, with that really speaks to, you know, how do I as a parent and or as a friend or a loved one show up, um, and have like knowledge and awareness of like my own emotional state when I'm holding space for somebody, especially when that is a teen coming forward with like, I'm struggling with this, or I've just tried this, or you know, have a friend that's struggling with this, right? And if I'm you know, not, if I don't have the ability or capacity to like detach emotionally from that to just hear and create a moment of space, ends up being really, really difficult. And we teach teens that they can't come to us, right? That we're not safe emotionally. And you know, that's where, you know, separating the what do I do about this problem versus like how do I hold this problem, it's sort of two different topics. And yeah, that would be like my first take of that. But such a good question.
Totally. It's hard for us not to go in on each one of these questions. We're trying to get through as many as possible and hopefully leave some space at the end to kind of like dive into these topics further, because this could probably be a 2-hour webinar, truly. I'm interested in things to talk about and do to ensure kids don't ever want to try vaping and drugs. Karissa, any suggestions there?
All right. Well, unfortunately, we can't ensure that our kids will never want to try vaping or drugs. We were just talking earlier, just even, vaping it's marketed toward kids. It smells fruity and like candy and, so that is enticing in itself. But there are certainly some things families can do to help, hopefully decrease the desire, or that your teen will actually participate in vaping or trying other drugs. Um, and we mentioned earlier about, sort of these risk-taking years. And so one of the things that can be helpful is encouraging your teen to engage in healthy risk-taking behaviors, right? So what are some healthy risk-taking? Maybe participating in a sport or trying out for the school play, or getting involved in clubs and having family, experiences that don't include drugs or alcohol. So all of those things can help like lead toward your teen wanting to live a healthy lifestyle, but unfortunately, there's no guarantee in um, ensuring that your teen won't ever want to try anything. But again, like to what Sebastian and Tim have been sharing as well, structure, routine, get to know your kids' friends. And give them some autonomy too to make some choices within a construct and boundary that feels safe, but that they're taking some risk.
The only thing that I'll add, Carissa, is when it comes to things like vaping and cannabis use and substance use, my experience is not a matter of if, it's just simply a matter of when this exposure will happen, right? And so I'm very when I talk with parents, I think it's really important to be as proactive as possible, truly to start having these conversations and modeling open and honest and vulnerable conversations and being inquisitive, right? Asking a lot of the questions about, hey, what do you see? What are your friends struggling with? What's going on at school, right? Because I've worked with a lot of great schools that have vape detectors, things like that. And believe me, the schools are doing everything in their power, especially in the Beach Cities area and other communities here in the Los Angeles area, to be as forward as possible with prevention and that kind of thing. But I think it starts in the home, and what's being modeled in the home, and open and honest dialogues within the home is really going to set the precedence within each and every family. So that would be my little 2 cents to throw on there. Tim, a question for you is, how easy is it to get drugs as a teenager? What is the source? How prevalent is it in some of our local schools?
Um, and feel free, Sebastian. I know this is another good one for you in that space, but at least the trends that we're seeing or that I'm seeing more on the direct program level is a high degree of frequency and a higher degree of acuity. Substances that teens 10 years ago were not using are now experimenting or trying or forming dependency on. Accessibility, I think, is huge, and a lot of that can be is sort of dependent on, is there a friend in the teen support system that was recently caught, right? The way that sort of those relational dynamics happen, it's often if one's doing it, maybe more than one are doing it, right? Siblings that have history of substance use, and potentially the way that trickles down is a big pattern. Accessibility in the home, right? Again, just like calling that what that is, right? Like the accessibility of alcohol and or THC, other substances like that are around, I think is a variable to consider. Yeah, at first glance, that's what comes to mind. But yeah, feel free to add to that.
And I think there's a lot of social pressure, right? And
Mm.
Tim, you talked about friend group, right? And in my experience, even if kids and young people are getting the education and they know and they don't want to participate, sometimes the social pressure, they don't want to ostracize themselves. In my experience, young people, the most important thing is like one, agency, and two, their friends' opinions of them, right? And sometimes without even really being forced, they want to engage in an act. If friends are starting to experiment with vaping, cannabis use, things like that, they want to do that because it's something that they can participate in that will help to keep up social norms in that respect. And so I always encourage when I'm talking to middle school parents is to like really set up an alibi for them. So if teens are in a situation, a social situation that they want to bow out of, but they don't necessarily know how to without being ostracized, I always tell parents like, hey, come up with a code name that or code word via text messages that if a young person sends that to you, if a loved one sends to you that you know in 30 seconds you need to call them and come up with an excuse as to why it is that they need to come home or why it is that you're picking them up. It gives them an alibi that they can kind of lean on in social situations to not get involved in whatever it is that the cool kids may be participating in or the friends in the locker room, right? And so obviously that's a nuanced situation, but we want to create these alibis, and that obviously comes from having a conversation, prior, so that teens know that they can lean on their parents for support in that respect. What is the age to talk to kids about drugs? Preteen? How young? Carissa, do you want to navigate that one?
Sure. I will speak from a personal anecdote here. So when my kids were toddlers. They were 2 when my mom died due to alcoholism. And so I started talking to them at 2 about it. Again, age appropriate, developmentally appropriate. So the starter was grandma died from a disease called addiction, right? And then if they had questions, I would answer them age appropriately. But it's been a conversation in my family, and again, it's generational too, since they were 2, and those conversations became, like I mentioned earlier, more sophisticated as they got older. And so, it depends on your family's makeup, but certainly I don't think there's ever an age where it's too young to start. We want to, as Sebastian and Tim shared, you want to get ahead of it, um, because kids are exposed at very young ages. And you just never know. You want them to have some information and be prepared as much as possible and be informed.
Awesome. Thank you.
Mhm.
So the next question is specifically about Kratom. Now, obviously, when we were kind of getting the word out about this conversation, and I might need to be cut off in this one because I got a lot to say about Kratom. Kratom, for those of you who aren't familiar with Kratom, this is a new substance that we're seeing very, very prevalent in local high schools because of access to it. Kratom is marketed as a health solution, a supplement that people can take to help them relax. Kratom is an opiate derivative. It's a synthetic opiate derivative. Yes, it does come about from natural compounds, but essentially has been synthesized in a way to where it is very, very potent, and it brings on the psychoactive effects similar to that of an opiate high. And for many of you all are familiar with what an opiate high may look like, sleepiness, drowsy. But the problem with Kratom is this is not regulated by the FDA. This is available at local liquor stores. This is available at local smoke shops all over the South Bay and truly all over the state of California. And it comes in a pill form, it comes in a powder form, and it's also now being seen in drinks. If you do a little bit of research, there's a drink called Feel Free, which has kava and kratom extract within it. And they have unfortunately started to synthesize this stuff and make it into specifically really high potent extract form, which comes in a pill form known as 7-O. And it's very, very problematic. Young people are getting access to this stuff. It can be delivered on um, Instacart. It can be delivered on Uber Eats, is what I've been told, and deliverable right to our loved ones' homes. And so, for folks that use this, within 3 uses of this substance, it has addictive properties that create a physical dependency. And so, we need to do a lot. It's only in one county in the state of California that it has been regulated. The sale of kratom has been regulated to where it is that it's illegal. That doesn't mean that it's not available, right? For so long, there was regulation surrounding flavored nicotine vapes, and I'll be honest, it hasn't changed much within the local scene. There's still tons of access to flavors, things of that kind of nature, and so you just need to make yourself aware of this substance. How would it show up? It's going to look in powder form, which will look like a tea, like an herbal tea. It also comes in capsuled pill forms, and then some of the higher concentrated stuff comes in pill forms as well, but they look like just standard white pills with nothing really written on them. And again, available all over smoke shops, all over the South Bay and greater Los Angeles area. Available, I've heard most recently at 7-Eleven. It's been marketed historically at places like Erewhon. I recently scoured Erewhon off Rosecrans, the new location here in the South Bay. Couldn't find any, but historically I knew that it was available at their Venice location. And so families just need to be aware. Other substances that are very prominent that I wanted to talk about are things like inhalants that are being made available through local head shops and smoke shops, right? The teens call it galaxy gas. And this is true to form inhalants. It's the same psychoactive effect that someone would get from huffing on an aerosol can. Very, very harmful, very dangerous. And both of these substances that I've just mentioned are not going to be detectable on your traditional 12-panel drug test. So parents need to be made aware of that. They do make specific drug tests that can test for these items. But again, on your traditional 12-panel drug test that you may purchase from your local CVS and Walgreens, it is not going to detect this stuff. And that's why it's such a problem. And we really need to this is where where the information starts. But we're seeing a lot of young people from Miracosta, from Redondo, schools like that are starting to lean on these substances because of maybe they're being drug tested by a facility and or in home. And so you all need to be aware of that kind of stuff. Okay. What sign should parents look for in terms of mood changes? Tim, can you try and synthesize that one a little bit?
Yeah, of course. In short form, I would say, I think if I'm going with mood first, really unexplained, like loss of pleasure or interest. I know we sort of talked about this a little bit. Schools, friend groups, hobbies, withdrawal and isolation is, I think, a big one. I think one of the things that's less talked about is anger, as a sort of a different manifestation of like typical or standard depression in that way. So, really incongruent episodes of anger and or even aggression is typically a sign of something that's going on. Also just really watching out for like inconsistent narratives, stories about where you were, where you went, what the plan is, right? I think Sebastian again sort of mentioned this earlier, that if you're watching close enough, that it starts to clash, right? It starts to not make sense, and I think that's your cue of like potentially some of these other approaches we're talking about more of a direct line of questioning around what's going on is super important. But yeah, and mood really being there's a kind of I think mood is like, oh, I feel bad or I feel sad or I feel happy, right? But there's sort of a behavioral expression of that, right? And really thinking about what that looks like for your teen specifically is important.
Awesome. How do you describe the difference between allowable amounts of alcohol, edibles, cannabis, and too much for teens? Karissa, do you want to answer that?
Yeah, I think you beautifully stated it earlier. Like at this stage of where we are with the accessibility to really dangerous substances, hopefully we get to a place where there is no allowable. Um, it's too dangerous. Teens' brains aren't fully developed and their bodies can't tolerate what would even be typically historically considered normal, allowable, okay amounts of alcohol. Um, and as Sebastian mentioned earlier, the cannabis is not what it used to be. Um, so that's the hope that we're gonna get to a place where there isn't really an allowable amount. Knowing that right now the likelihood that teens are going to engage in some sort of substance use experimentally is going to happen. You want to make sure that you are not sending mixed messages. So it's a really fine line that parents and caregivers and adults in adolescents world are navigating. You're trying to have these open dialogue conversations without judgment and setting clear boundaries and expectations, and you want your teens talking to you, but you also want to send the message that this is all really scary stuff and don't want to allow any of it.
Totally. Totally. Obviously easier said than done, but we
Easier said
want to
than
be
done.
proactive. Totally. Another question that we got is what are the best resources to keep up with the new thing trend so we can pick up on lingo to watch out for? It's tough to answer this question because things are changing all the time, right? There was a question in the chat about Mitra 9, which is another kratom kava extract drink. And so this stuff is changing all the time. Things are being marketed specifically towards young people. And obviously there exists a lot of applications to help monitor things like in spot check, social media and things like that. Listen, there are some really, really amazing local resources. Obviously, we're available to answer any questions about things that we're seeing within our community. But locally, I would really lean on folks from your local schools, right? And kind of lean on schools school counselors and social workers. We're so fortunate here in Los Angeles that many of the schools in the local area have brought on wellness centers after COVID. And so those social workers and counselors that are aligned with schools are really seeing what's happening on the ground floor and seeing what's going on with students, and they can kind of privy you up to some of the lingo. I'll also mention Alcove, which is another local resource here in the South Bay. It's a free wellness center that offers, really great solutions and community for young people at little to at no cost, right? And that's not far here. It's planted in the South Bay, and it's really been an amazing organization to be aligned with. They're really on the forefront of prevention. But again, if you're using a Life 360 or you're using a thing like a Bark phone, which monitors location, things like that, just be aware that a lot of young people have ways to navigate around these things. Most young people know that if they go on airplane mode on Life 360, that it will that's the last location it will share. Then you turn airplane mode on when you're back at that location, and it will show that you've stayed at that location. But you want to be ahead of the curve and look out for terminology like stizzy, which is a cannabis, it's a cannabis vape, right? Kratom, kava, those are things. Galaxy gas I mentioned earlier, right? And it's hard even for us as professionals just to stay ahead of the curve, because oftentimes lingo and the media and the access to even social media, that is a black hole of just a lot of illicit information. Some of it good, most of it bad, transparently. And so I would obviously say spot check and really lean on your local resources, whether that be Karissa, Tim, myself, Alco, your school counselors, and really lean on people. And I find oftentimes parents don't want to ask those questions because of the stigma that's associated with them. And there's nothing, absolutely nothing wrong with getting informed as parents and being cognizant of those new lingos that are often coming up in a moment's notice. Another question we got is, how can families build resilience to help teens make safer choices when experimenting or facing peer pressure? Carissa, do you want to take that one?
Sure. So yes, you, Sebastian and Tim have already mentioned some of the things already that really help build resiliency in teens, to make healthier choices or safer choices and decisions, including having some sort of plan to get themselves out of a tricky situation, right? I know for myself, when my kids were teens, like if you're at something, call me, pick you up anytime, no questions asked. And I had to stick by that, right? Like, I'm not going to ask you any questions as long as you're safe and you call me. Like, it's hard as a parent. You want to know, like, what's going on, what happened, what did you almost get yourself into? So holding to that, again, building the safe, open communication and dialogue, helping your teen set boundaries for themselves and advocating for themselves, um, going back to getting to know their friends, where are they at, being in connection with their friends' parents, um, supporting and encouraging extracurricular activities. All of those things kind of help build an internal decision-making sort of assistant within them. Um, yeah, so that's those are some of the things that, again, there's no guarantee, but you want to prevent as much as possible by building some of these um, boundaries and communication and information and system within your families.
Totally. Can you explain vaping to a parent that hasn't experienced it? How can a parent test vape juice for suspicion of added drugs, not just flavor of nicotine? Tim, you want to take a crack at that one?
Yeah, I mean, this is a tough one. Again, nicotine being a vaporized was intended to be a replacement for smoking and harmful tobacco related products, obviously, and the ways there's like a pretty strong smell, right? If you walk into a teen's bedroom and it's pretty pronounced in that way, especially if it's a flavored one. It's just something you can sort of look out for. Um, Usually contraption, like the actual mechanism of it varies in size. Some of them are relatively small and some of them are bigger and bulkier and pretty noticeable, like in a pocket or if left out somewhere. I think challenging again, like, you know, the traditional 12-panel UAs don't necessarily screen for everything that we're looking for these days. There are other options with like blood tests and like formal lab resulted testing mechanisms for those types of things. I'm trying to think of any other pieces of that. Sebastian, anything else you would add to that?
Yeah, I mean, listen, I think more often than not, the vaping, like what you want to look for if you're a parent starting to scour a room, and again, I'm very I don't know if conservative is the right word, but I always encourage parents. I'm like, listen, if they're in your home, you have every right to search. Um, I'd be kicking my 17-year-old self is angry with what it is that I'm saying right now, and that's why it's important for me to say it. So like I think parents have a responsibility that if they're in your home and they're driving a car that may be under your name, you as a parent have every right to look and search their stuff. I'd rather you do that rather than face some of the consequences that I'm just all too familiar with, right? Make decisions as parents that will help you live with the least amount of regrets. But to look for vapes, it's tricky because these things can easily look like a USB driver these days, right? But a lot of the ones that are commonly seen in local high schools and middle schools are disposable vapes, and they look like brightly colored squares, right, with a little nozzle on the end of it, and those are the things that you're going to want to look out for. It doesn't smell like a cigarette, and more and more often, kids are getting smart because these things are being kind of searched for on campuses, right? Another thing to kind of mention is Zyn, nicotine lozenges and Zyn. We see that more and more often because it's easier to hide. You simply place one of those in your gums, and you don't have to worry about exhaling a big cloud of smoke, right? A lot of the same psychoactive effects, addictive properties that are in those, similarly to vapes. So things to look out for. Zyn will look like a traditional, like a nicotine, a container with like yeah, like what's the word that I'm looking for? Chewing tobacco, really. It's going to come similar to chewing tobacco, but they're small white pouches. And so if you start seeing those in the trash cans, out on the street, things like that, conversations to be had there, right? Um, I'm just going to talk about local resources because that was one of the questions. I definitely, I previously mentioned Alcove. I'll mention school counselors, though school counselors, social workers that are working on campuses are there to support and provide wellness opportunities for your young people. I really want to encourage parents to lean on those local resources, specifically in the South Bay and the greater Los Angeles area. Continue to come to our webinars and get more information and ask for help. There's plenty of parent support groups that exist too. So if you're a parent and you're finding that you're struggling, your loved one struggling with whether it be substances or truly true to form mental health, NAMI, National Alliance for Mental Illnesses, they have peer-to-peer support groups for parents of addicted loved ones. There's a group that meets at one of the Clear Behavioral Health locations every Thursday night at 7 o'clock, which is a support group simply for parents of young people struggling with substance use, and a lot of other supports. Please ask your local high school counselor, middle school counselor, social workers that work at some of these wellness centers. Access Alcove if you find yourself in the South Bay. They have tons of great resources that are available. And obviously, our phones, emails will always be made available to anyone on these webinars. We're here to answer questions and really just try and give you the best support that you can. Clear Behavioral Health has several locations to provide support at an outpatient level of care. We've got Neuro Wellness Spa, which offers Gen Psych appointments. So there's just a lot of different avenues. You simply have to just look, and we're going to provide some of that information as we close out here. Maybe one of the last questions we can tackle here before it is that we try and answer some of the questions that are in the chat. My teen has a friend they're worried about with regard to alcohol and drug use, but they don't want that friend to get in trouble. What should I do? Either one of you want to take a crack at this one?
Yeah, I think I'll just mention, and feel free to add anything, Karissa or Sebastian, but the peer-to-peer alliance with teens is really profound. If anything, it's a huge part of the model that we sort of operate from, that sort of connection element. And I would say if that teen has a friend that they're struggling, it's sort of a similar thing that I would tell parents, right? Like really leaning into curiosity, really leaning into like a non-judgmental stance of, hey, I'm concerned. I'm worried about what's going on. Are you okay? Is there anything I can do to support you? Right. starting that being really the starting point to create the dialogue to talk about what's going on, and then escalating as needed. You know, at least how the teen can support in that way. But if it is at the parent level, I do think there is an obligation to communicate with other parents if there's something going on, and there's a question of safety in that way. But yeah.
Yeah, the one thing that I always encourage is like, especially in today's trends, I think we need to encourage our young people that if they're seeing a friend, to not necessarily just shun them out, to leave an open door, but to set some healthy boundaries in the same respect, and encourage them to say things like, "Hey, I really care about you. I'm not that excited about some of the choices you're making, and I have to create some safe distance, but my door will always be open. Should you need anything, should you need someone to talk to, or if you feel like this is getting into a position where it is that things are getting out of control, I'm always going to be someone that you can lean on to really help and model like destigmatizing some of these conversations within our respective homes, and then hopefully that can disperse out to the friend groups as well. I think that's the one thing that I would add.
It's a good, really great point.
Mhm.
There's been a couple questions in the chat, and I'm going to just kind of breeze over them. A parent mentioned lean as another like lingo or term. For families that aren't familiar with what that term is, lean refers to, it's made popular in a lot of media, hip hop music, very trending. It's not as common any longer, but lean refers to hydrocodone cough syrup that was often, memorized through media and songs and stuff like that. Nowadays, we see a lot of people referring to lean as just traditional cough syrup that may be available and easily stolen from your local Walgreens, CVS. A lot of local stores have started locking that stuff up and making it so that it's not easily accessible. So this is your Delsum cough syrups, that kind of stuff. If you take enough of it, there's certainly been an influx of young people taking Benadryl in excess too, right? And that can produce some psychoactive effects that will create a euphoric experience, right? And so nowadays more than ever, parents need to be really aware of what it is that's in their medicine cabinet and make sure that there's healthy parameters around that stuff, and be cognizant of some of the things in there. Unfortunately, with the influx of media and things like that, and just access to information via online portals, our loved ones and young people can get access to this information like never before. And while they may be not great researchers in school, or maybe they are researching this stuff too in a very unhealthy way. And so I really encourage parents to have locking devices on any medicine cabinet, because they can easily look up the substances and things of that kind of nature, and use it and get access to it. Couple other questions. So grateful. It looks like Kiefer placed some information for Amazon for testing kits specifically for kratom, testing dipsticks, and I think that's really important to have. Another question that we got is about specifically like testing strips and giving and having access to things like testing strips and naloxone or Narcan in their home. And if you're not familiar with naloxone or Narcan or testing strips, that's to test substances for fentanyl being in those substances. Narcan is a opiate antagonist. It basically can reverse the effects of an overdose situation. And the unfortunate truth is this, in my experience, I'd rather you have the fire extinguisher and never have a fire than to have a fire and not have a fire extinguisher, if that tracks, right? And so Narcan is available through Alcove, previously mentioned, through local pharmacies, things like that. It's a nasal inhalant that if someone's experiencing signs and symptoms of an opiate overdose, it could be administered through through a nasal ingestion, and it really does save lives. And I would encourage, I keep some with me wherever it is that I go. I have some in my home. I have it in my car. I'd rather have it and not need it than the opposite. And I think if you want more information on Narcan or naloxone and how to access that stuff, again, Alcove has plenty to distribute. We have access to distribute that. I've been partnered with End Overdose, and which is really great organization that comes to local schools, events, music festivals, and does boots on the ground education and signs and symptoms. They make plenty of good YouTube videos as well on how to administer, and there's no negative consequences from administering it. If someone's not actually having an overdose, if you administer it, there's truly no negative consequences from administering something like that. Um, Another question, and maybe Karissa, Tim, you can tackle this one. At what point would you begin drug testing?
Yeah, we often encourage parents to drug test when they're not with us in some of our programs. If you suspect that your teen is using, so I'd have the preemptive conversations, right? You know, uh, if at any point I am concerned or worried or suspect that you might be using, I'm going to use my right as a parent to test you when I'm suspicious or feeling doubtful. And again, the conversation is around, I, as a parent, I need to do my job to keep you safe. So as far as like a specific age or something like that, I don't have an answer. It's, back to like what Sebastian was sharing earlier, like trusting your instincts and gut. I wouldn't necessarily start testing every teenager at a certain age. It's dependent on what you're suspecting or worried or concerned about.
Another question, what are the predominant drugs in local high schools right now? Pot vaping, that kind of thing, cocaine, pills, etc. Um, I mean, I can answer this. Predominantly, what's most commonly abused, nicotine. Nicotine is really a segue, right? Young people are experimenting with that just because of ease of access to it. And then it usually titrates up to a cannabis, alcohol, things like that. Very, very common around 15, 16, 17. Is cocaine prevalent? Yes. Is ecstasy and MDMA? In my experience, the substance use that's prevalent really goes with the times, right? During the pandemic, during COVID, we saw a lot of people struggling with opiate use. It's rampantly available, right? It was really in almost all of the substances, and that's why in 2020 it was the leading cause of death for young people between the ages of 18 and 45, which is bonkers that we're talking about it. Since the pandemic has wrapped up, we see a lot of more people considering that so many of our young people were in virtual education for such a long time. A lot more people are struggling with anxiety, anxiety problems, issues with struggling with feeling a part of, depression symptoms, things like that. And what comes along with that is like, yeah, we see a huge influx of cannabis use, huge, alcohol use is on the rise, right? We see, yeah, anxiety medication specifically, right? So, benzos, Xanax, Valium, those are the common ones. And those are easily accessible. The unfortunate part is if our young people are purchasing those substances through Snapchat or off the street, the likelihood that the stuff that they're taking is not what it is that it's being marketed to them as is very, very likely. And so they stand the risk of potentially administering or taking fentanyl-laced substances. And so we need to be cognizant of that as well. Um, Other questions in the chat.
Sebastian, I noticed that one about, I think there was sort of a comment about experimentation and abstinence and just to comment on that super quickly that I think the reality of like where we are and part of the reason why we're having this dialogue here tonight is that it is gonna happen, right? I think you made that point earlier, Sebastian, of like if it's not when, it's not if, it's when, right? And I think that the takeaway, at least my hope for the takeaway is that I have an understanding of the resources that are available, that I know what to do if I am in that situation, and that hopefully we can instill some degree of education and understanding to the teens about the risks that aren't there's a lot of misinformation out there, right, around what's in these chemical, what are the chemical compounds, what to stay away from, what can lead to this based on prognosis, and how to, how to support, right, to prevent long term, the problems that we see in adulthood. So just wanted to mention that, easier said than done, 100%. The goal might be abstinence, but the reality is that it might not look like that. So.
Yeah. And just being cognizant of times. Chris, any closing thoughts here that you just want to leave folks with, similar to what it is that Tim just mentioned,
Yeah.
tangible skills that parents can take home and be cognizant of?
Yeah, just to kind of piggyback off of what Tim shared too, that transitioning from teenage years into adulthood and how do you, navigate supporting, knowing, what adulthood sort of looks like. Again, to Tim's point, and Sebastian's point, we're hoping that the goal is abstinence and that these conversations are starting at very early on. So by the time your kids are, out of the house and they're entering adulthood, they're fully informed to make what decisions they're going to make. And that you feel confident in them making decisions that are healthy and right for them.
Totally agree. Awesome. Last thing that I'll close with is obviously by you all asking questions and being here in the space, it serves to that we're going to hopefully move the needle in the right direction here. Some tangible skills I always talk about. Yes, create that social alibi for your teen, start having these conversations and really modeling. Tim talked about it earlier, but modeling is really active listening and really making sure that you're spending a lot of time not lecturing, but listening to what it is that your young people are going through, your loved ones are going through. Always, always, always confirm their location through another adult. It's always something I suggest, right? If I was 16 and I told my mom I was spending the night at Austin's house, the likelihood was I was not spending the night at Austin's house, right? And so I always suggest parents to connect with other parents just to confirm, right? It's a trust but verify thing, and really listen to your intuition, listen to your gut. If you have more questions, please don't hesitate to reach out. I want to take a moment to just thank our sponsors this evening. Obviously, we've had amazing people that have been involved in putting this whole thing together. Alcove, the Beach Cities Health District, Redondo Union Wellness Center, and Drug Free Communities. Thank you for helping to make this thing possible. We're going to pass on some more information about our next webinar because we're going to continue to do these and talk about different subjects. The next topic is going to be blurred realities, how social media and AI are shaping teen mental health. And so we don't have a date for it yet. It's going to be in December, and we really hope you'll join and bring a friend and encourage family members and neighbors to come join us in these talks. We continue to partner with the Beach Cities Health District. We speak at every local middle school, every local high school annually, from Palos Verdes to El Segundo High School and all the schools in between. And we're not stopping that. We're going to continue to have these talks and create parent forums and seminars to where it is that these questions can be answered. But it starts within our own respective home. It starts within our loved ones in our community, and starts with just these vulnerable and honest conversations. So, please do not hesitate to reach out to Karissa, Tim, or myself. We're here to answer your questions. Clear Behavioral Health is available. New Life House is available. And we can hope to continue to support the South Bay community, the Beach Cities area, and all over Southern California. We're here to help. So thank you so much for joining us this evening. We'll put some information up. Please do not hesitate to reach out, and we will be absolutely sure to send out the recording to everyone so that this is easily accessible and parents can get this information. Thanks so much for joining us.